Chair Liu, Chair Aguilar. 52 years ago, with Roe v. Wade, our country established the fundamental freedom for women to make their own healthcare decisions. And as a result, more women had access to critical care and better health outcomes. Since then, we've seen anti-choice extremists roll that right back, and they've taken steps to ban access to reproductive care entirely. And it is my belief that this has had devastating impacts on women across the country, disproportionately affecting women of color, women with low incomes, and women in rural communities. Now, this week, House Republicans are having us vote on a bill that continues to undermine women's access to health care. For me, that's unacceptable, and it's frankly not what I was sent here to work on. So I'll be voting no. The evidence is clear. In states with less access to care, maternal mortality is higher, infant deaths are higher, and racial inequities are greater. These restrictions also make it harder for expecting mothers to receive the care they need in pregnancies and complications. So that is why I will fight for all women to have access to reproductive care and to be able to make those decisions for themselves. I believe that women shouldn't have to pay thousands of dollars to travel across state lines or risk prosecution to access basic health care. For me, it's nonsense that my daughters, I have two of them, that they'll have less rights than I did at their age. It's nonsense that they've had to decide where to live and go to school based on where they'll have rights. And it's nonsense that my daughters are less safe because of government interference in their health care. It's time that House Republicans put aside this foolishness and start focusing on real issues like eliminating maternal mortality and increasing rural access to health care, like lowering costs and creating good jobs, and like working across the aisle to deliver real results for real people. Thank you. And now I'll hand it over to Rep. Kelly Morrison of Minnesota.